Ketamine Addictive. Many people know ketamine as a drug of abuse, more so than as an antidepressant. Ketamine was first developed as an anesthetic medicine that had pain-relieving properties. Some of this pain relief may be from the dissociative effects of the medicine. Dissociation means it can disconnect you physically from yourself. Mild dissociation can feel like things are moving in slow motion, maybe feeling separate from reality or things seeming unreal. Sights and sounds can seem different, brighter, or more intense. You can lose track of time. You may find things slow down or speed up. This may sound scary, but many people find it relaxing, enjoyable, and even psychologically insightful. High doses, or if you're very sensitive to the medicine, can even create a transformative, mystical experience. In fact, the high doses used when people abuse the drug illegally can have an experience called the K-hole, in which reality can completely fade away and lead to illusions or hallucinations. The doses that we use to treat depression aren't that high, and those types of experiences are rare. When the drug is abused like that, it's unlikely to have any sustained antidepressant effect. People who are looking to escape reality or maybe have one of those chemically induced mystical experiences may find themselves drawn to abuse ketamine. There seems to be more tendency for psychological addiction rather than physical addiction. Ketamine doesn't seem to have the same physical dependence or withdrawal that you see with narcotic or opiate pain medicines, anxiety or benzodiazepine medicines like Xanax, Valium, or Klonopin, or even alcohol. Some researchers have suggested that many people may abuse ketamine because it's just easy to access, given that it has medical uses and it's more available. Or maybe they're self-medicating depression or anxiety. While there are people that may go to ketamine treatment centers to get high off the medicine, it sure is an expensive way to get the drug, where it's more readily and cheaply available on the street. Also, in most ketamine treatment centers, the drug is only administered in the office, so people don't really have the ability to abuse it anyway. Healthcare providers who use ketamine to treat depression just don't see many people coming in for more frequent visits just to abuse the medicine. But it can happen. On the other hand, there are many studies that have shown that ketamine actually may be an effective drug to treat addiction. There's some evidence that people who abuse alcohol, marijuana, cocaine, and pain medicines that have experienced reduced cravings for their drug of abuse when they've gotten ketamine treatment. Some have actually stopped abusing drugs or alcohol when given ketamine. Either that means it's impacting addiction itself, or it's treating depression and anxious feelings that may lead to addiction. Right now it's not so clear. This means that someone who has an addiction history or is currently abusing drugs and alcohol may still be a good candidate for ketamine. Most healthcare practitioners believe, though, that you're not likely to get a good antidepressant effect from ketamine if you're still abusing drugs or alcohol along with your ketamine treatment. Also, it can be unsafe to give ketamine to someone who is actively abusing drugs or alcohol. For example, if amphetamines or cocaine are in your body and you get ketamine, it can significantly raise your blood pressure. If you have high doses of benzodiazepines like Xanax, opiate pain meds, or alcohol in your body, while you're getting ketamine, this can lead to dangerous levels of sedation or even unconsciousness. Ketamine centers like ours are careful about who we give ketamine to make sure that someone isn't just drug seeking and is really looking for treatment. But again, drug seeking is not as common as you might think. Also, we insist patients not be actively using drugs or alcohol while getting ketamine. Although a recent and past history of drug and alcohol abuse does not necessarily preclude you from getting a ketamine treatment. That has to be determined really on a case-by-case basis. We watch for signs of drug seeking and would likely not continue treatment if we thought someone was not using the medicine appropriately. We would also help them find treatment for their addiction, since it's most likely contributing to any depression or anxiety they may be experiencing. and it's likely holding them back from living a fulfilling life. But even with ketamine's history as a drug of abuse, ketamine still seems to be a safe, effective, and life-changing treatment for many of those suffering with depression, anxiety, and other mental health problems that haven't responded to traditional antidepressant therapies.